The focus of today's conference is a fundamental approach to mental health issues that face our military veteran and their families. The 6 presenters take a varied approach to addressing mental health needs of those who have served. Our first presenter, and I'm very, very pleased to have Tracy Malone, the president of the United Health Foundation, agreed to be the very first opening speaker. She is the primary liaison for United Health Group Military and Veterans Healthcare Initiatives. She has led efforts to advance the company's commitment to service members, veterans, and their families, distinguishing the enterprise as a thought leader in military and veterans health and advancing military and veterans growth opportunities. She served 26 years as a Navy officer, including the Chief of Staff to the Assistant Secretary of Defense of Health Affairs, and a tour at the White House medical unit coordinating medical service support for President Ronald Reagan and the Vice President George H.W. Bush. Tracy holds a BSN degree. She holds a MSN from the University of Colorado, and her military decoration include the Defense Superior Service Medal, Defense Meritorious Service Medal, a Navy Meritorious Service Medal with 3 awards, and the Navy Accommodation Medal with 2 awards. It is my true pleasure to introduce Tracy Malone. She will present information on understanding the health of those who have served. Tracy?
Thank you, Sue, so much for that great introduction, and I'm delighted to participate in this conference today. As Sue said, I'm Tracy Malone, and I lead United Health Group's corporate social responsibility efforts, and I'm also the president of the United Health Foundation. And we're delighted to be part of this event today. Our mission at United Health Group is to help people live healthier lives and to help make the healthcare system work better for everyone. Our 325,000 employees across the globe are all driven by this mission, and we all share a common vision for creating the next generation healthcare system that provides exceptional value to society, and doing that one person at a time. I'm also speaking to you today as a veteran, as Sue said, share that with Sue, as 26 years of service as a Navy Nurse Corps officer. And military culture has certainly shaped my life, as I'm sure has for many of you. I want to especially welcome my fellow veterans who may be joining us today for this important conference. United Health Group has a long-standing commitment to building a diverse, culturally competent health workforce. Cultural competency has long been recognized as an important aspect of improving care quality. Educating healthcare providers to better understand military culture and the distinct health characteristics of those who have served will help those providers deliver better care and ultimately improve health outcomes. That is why United Health Foundation is so proud to partner with the FSU's College of Nursing and commit $1.25 million over the next 3 years to create a new military health concentration for FSU's nurse practitioners students. And you heard Sue talk about the various programs and electives. Sue, I wish I could go back and start all over again and take all those courses. They sound amazing. But FSU has long been supporting military and veterans, many of whom are FSU students and alumni. This new military health concentration will distinguish FSU's graduating nurse practitioners and prepare them to deliver the top-notch care to service members, veterans, and their families that they deserve here in Florida as well as across the country. The United Health Foundation's partnership with FSU also recognizes the importance of training nurses who are already practicing about the distinct health needs of those who have served. We're delighted to support this inaugural Military and Veterans Health Conference, and I want to convey how impressed I am by FSU's creativity and commitment to safely holding this event and building such a great agenda for today. And a big shout out to Sue and to Gabby and the entire FSU team who really worked hard to pull this together. I'm really looking forward to hearing from the other distinguished presenters during today's conference. So to get us started, I'd like to share with you research that the United Health Foundation has conducted on the health of those who have served. In partnership with the Military Officers Association of America, otherwise known as MOA, the United Health Foundation has been studying the health of those who have served since 2016. We've identified trends in the health of those who have served and how that differs from their civilian peers. And our goal is to provide an objective benchmark and roadmap to improve the physical and mental health of our service members and veterans. In the next 45 minutes or so, we'll focus on exploring the differences in the health and well-being between those who have served in the U.S. Armed Forces and their civilian peers, including how these differences have changed over time. We'll specifically examine mental health concerns that are more prevalent among those who have served, including how the prevalence of these issues varies by gender, age, and other population characteristics. And finally, and really most importantly, I hope to provide you with greater insights into the potential health challenges that are unique to the military and veteran population. America's Health Rankings is a long-standing platform that builds on the United Health Foundation's work to help draw attention to the cornerstones of public health. For over 30 years, the platform has checked the pulse of our nation, reporting on important trends in health and providing actionable, data-driven insights that stakeholders can use to affect change either at the state level or at the national level and continue the dialogue of improving our nation's health. America's Health Rankings takes a holistic view of health, building on the World Health Organization's definition of health as a state of complete physical, mental, and social well-being, not merely the absence of disease or infirmity. Our most well-known publication and the longest-running state-by-state analysis of health in the country is our annual state rankings report, which measures the overall health of each state in the country. Alongside our reports, we have grown our website into a one-stop shop for timely public health data, currently featuring more than 160 measures of health. In recent years, we saw an opportunity to go deeper into the data and better understand the health of specific populations. We've developed detailed analyses on the health of key populations, including seniors, women and children, and the health of those who have served in the U.S. Armed Forces. Our inaugural Health of Those Who Have Served report was released in 2016 and served as a baseline portrait of the health of those who have served. We were fortunate to establish a long-standing partnership with MOA, as well as an advisory group of leading military, veteran, and public health organizations to ensure the report provided a holistic view of this population. We followed up that first report with the health of women who have served in 2017, specifically looking at the health of women in the U.S. Armed Forces who have served and the health, comparing that to the health of civilian women. And then we also released the Health of Those Who Have Served report in 2018, an updated report, which includes 31 measures of health to help us monitor the health of those who have served over time and in specific populations. Now, coming in November, we're going to be releasing a new data on the health of those who have served, which will highlight longer-term trends and emerging health issues impacting the health of our service members and veterans. Before getting deeper into the research, let's spend a few minutes to define those who have served. We are looking at the health of those who have ever served on active duty in the United States Armed Forces, either in the regular military or in a National Guard or Reserve unit. Active duty does not include training for the Reserve or National Guard, but does include activation, for example, such as the Persian Gulf War. Importantly, This definition does not differentiate current active military from those who have either separated or retired from military service. The health and well-being of those who have served continues to be a national priority. Nearly 23 million Americans living today have served on active duty, either in the U.S. Armed Forces or in the U.S. Armed Forces, 2.4 million of whom are currently on active duty or in the National Guard or Reserves, and more than 20 million who are retired. Over the next 50 years, the number of active duty personnel over the past 50 years, the number of active duty personnel has declined significantly from 3.5 million during the military draft era to 1.3 million as part of today's all-volunteer force. The U.S. Department of Veterans Affairs, the VA, who I know you're going to hear from shortly, projects that the veteran population will further decrease by over 30% over the next 3 decades to 13.1 million. During this time, we will also see the demographics of the veteran population shift. For example, the share of male veterans is expected to decline significantly, while the female veteran population will continue to grow. Racial and ethnic diversity among veterans will also increase. People of color currently make up approximately 20% of the total veteran population today, and that will grow to nearly 30% of the total veteran population by the year 2048. Notably, the composition of veterans by wartime era is also changing, with Gulf War era veterans spanning from 1990 through the present, now comprising the largest share of all U.S. veterans, surpassing those from the Vietnam War era. As a result, the changing face of military and veteran populations creates unique health challenges and new demands on the healthcare system. Our suite of the Health of Those Who Have Served reports provide key insights about the similarities and differences in health within groups of those who have served, as well as between those who have served and their civilian counterparts. The reports capture more than 6 years of data and are the only national resource to provide comprehensive population-based data and trends over time. One of the strengths of the America's Health Rankings platform is the input we receive from outside experts on the measures to include in each report and the feedback on how our findings fit within the public health community. We feel fortunate to work with many very qualified individuals from leading military, veterans, and public health organizations, from MOA, the American Legion, the VFW, the Service Women's Action Network, as well as RAND and CDC, and other important groups that were gracious enough to lend their expertise to designing these reports. These advisory groups helped us develop a framework that guide our reports. For these reports, we examined 31 measures of health across behaviors, clinical care, policy, community and environment, and health outcomes to provide a national portrait of the health of those who have served. You can see a full list of the measures on this slide, which include markers of health across these categories, including several measures related to mental health, such as anxiety, depression, and suicidal thoughts. The primary data source for the health of those who have served and the health of the women who have served reports is the Center for Disease Control and Prevention's Behavioral Risk Surveillance System. That's a mouthful. It's otherwise known as BRFIS, which is the world's largest population-based telephone survey. We also draw upon CDC's National Health Interview Survey, as well as SAMHSA's National Survey on Drug Use and Health. Now, as I mentioned earlier, those who have served are defined as those who have ever served in the U.S. Armed Forces. While all three of these data sources use this common definition, some differences do exist in who is included among those in service. For example, BRFIS, the CDC database, their measures focus on the health of those who have ever served in the U.S. Armed Forces, either in the regular military or in the National Guard or Military Reserve Unit. For the National Survey on Drug Use and Health, the measures there describe the health of those who have ever been in the U.S. Armed Forces and are not currently on active duty. And for the National Health Interview Survey, those measures describe the health of those who have ever served in the U.S. Armed Forces, Reserves, or National Guard, but are not currently serving on full-time active duty. Due to the specific wording of the survey questions, the data can't be broken down by military branch or compare the health of active duty military with retired veterans. So 2 additional notes on the methodology that I wanted to highlight are how we define the timeframes in the health of those who have served reports, and how our data is age adjusted for this analysis. The most recent report draws data from the 3 sources across 6 years, so from 2011 to 2016. During the analysis, the data were weighted and age adjusted into 3 2-year periods. Our baseline period covers 2011 to 2012 and provides a foundation by which to compare trends across different reports over time. The midpoint data covers 2013 to 2014, and these rates were presented as the current rate in the 2016 report and now represent an interim period in the trend analysis. And finally, the current data spans from 2015 to 2016 and provides the most current year's rates and an opportunity to measure change since both the midpoint and the baseline years. Unless I otherwise note, when I talk about our research today, I'm mainly featuring data from the most current period, which is 2015 to 2016, and that comparing that to our baseline period of 2011 to 2012. As I mentioned, we also age adjust. Those who have served on active duty have a different age distribution from the general public. And those who have served on active duty are generally older than those who have not served. So to prevent age from skewing the results, data included in the research were age adjusted to the 2000 US standard population. And this adjustment provides a fairer, more realistic comparison between those who have served and those who have not served. So let's now turn to some of the key findings from our research. Our data highlights that those who have served are more likely than their civilian counterparts to report that their health is either very good or excellent. And this is a difference that has generally not changed since our first report, since the first baseline data in 2011 and 2012. However, despite reporting better overall health, those who have served have higher rates of chronic disease and behavioral health concerns. Many chronic disease rates for those who have served, as you can see here on the slide, have not improved since 2011-2012, especially for those veterans who are 50 years old and older. This slide shows several chronic conditions, including arthritis, cancer, cardiovascular disease, and others, where those who have served have higher rates than their civilian peers. This is a key finding for this research because despite being more likely to say, "I'm doing great," those who have served are more likely to have a chronic condition than their civilian counterpart. Looking at the mental health of those who have served, our data highlights that both men and women who have served have higher rates of depression, anxiety, and frequent mental distress, more so than their civilian men and women counterparts. A striking finding is that depression has increased 9% overall since 2011-2012 among those who have served, and as much as 32% among those who have served age 26 to 34. And little improvement was observed in the rates of anxiety and frequent mental distress among those who have served during this time. One of the most serious mental health issues facing those who have served is suicide. Our research measures the prevalence of having had suicidal thoughts in the past year. While suicidal thoughts have become more common for both those who have served and civilians, those who have served are more likely to have had these thoughts. Consider this, that among those aged 35 to 49 who have served, the rate of suicidal thoughts is nearly double than that of those who have not served. Among college graduates, those who have served have almost twice the rate of suicidal thoughts than those who have not served. And suicidal thoughts are most common among those who have served who earned less than $30,000. As highlighted in our Health of Women Who Have Served report, women who have served face distinct health challenges. Our latest report found that among women who have served, the rate of suicidal thoughts tripled and the anxiety rate more than doubled since 2011-2012, a very concerning finding. There are also differences in rates of depression between women who have served and their civilian peers. What we find particularly interesting is how these differences occur by age. So younger women who have served are less likely to experience depression than their civilian counterparts, but that finding reverses itself for women aged 26 to 34, and depression remains higher among women who have served in the years following compared to civilian women. For both men and women, I do want to highlight one area where we saw improvements in mental health markers among those who have served, and that is a higher percentage of those who need treatment are reporting that they're getting it. Our most recent report found that the percentage of those who have served who have any mental illness and have received mental health treatment in the past 12 months has increased 23% since 2011-2012. And while this is really encouraging, it's also important to note that despite these improvements, half of those who have served who have a mental illness have not received mental health treatment during this time. While those who have served continue to face distinct health challenges, our data also shows strong access to and use of healthcare services by those who have served. Across several measures, men and women who have served fare better than their civilian counterparts, including getting colorectal cancer screenings, having had a dental visit in the last year, getting their flu vaccine, really important, especially as we go into flu season this year, and not having unmet medical needs due to cost. Those who have served have also have higher rates of insurance coverage than their civilian counterparts, a trend that has improved since 2011-2012, and may contribute to these encouraging preventive and primary care rates. However, those who have served still are less likely to have a dedicated healthcare provider than civilians, a trend we have observed in the data since 2011 and 2012. Now, let's talk about taking action to improve the health of those who have served. Given that few civilian healthcare providers have direct military experience or have received specialized training in military culture, improving the military cultural competency of our provider workforce is critical. The United Health Foundation has been focused on improving cultural competency among providers for years. In 2014, we partnered with RAND to release a study on the readiness of community-based mental health providers to treat veterans and identified the need for more training and the use of evidence-based approaches to meet the mental health needs of veterans. We've also partnered with the National Military Family Association to provide scholarships to military spouses who are seeking to complete their clinical training in mental health and counseling fields, all because we know that providers who understand the military culture will be better able to care for those who have served. Now, a common misperception is that all veterans get their care from the VA. It's important to remember that not all veterans are eligible for VA care, and that even among those who are eligible, veterans often seek care from multiple sources, including from private sector providers in the community. Preparing these community providers to care for veterans is important. RAND released a study in 2018 that looked at providers and their understandings of military culture, using New York State as a case study. The research found that there's still room for increased understanding. For example, only 11% of nurse practitioners outside of the mental health field screened for current or previous military service. Less than half of nurse practitioners screened for common conditions among veterans, and they also found that across all provider types, only 25% of providers reported familiarity with the specific healthcare needs of women veterans. So these findings reinforce to me that this conference is critical, and the knowledge you are gaining today makes you distinctive, as most of your peers are not getting this type of training. So I hope that this has given you more insight into the distinct health characteristics of those with military service. We have a great opportunity to help improve the health of our service members and veterans. And it starts by increasing our understanding of those who have served this great nation, one person at a time. Thank you again for the pleasure of being here today. And now I'm happy to turn it back to you, Sue, and answer any questions that our audience may have.
Thank you, thank you, Tracy. That was, you have me at all of those statistics. I am so amazed. Do we have questions for Tracy?
We do. We've got a question in, Tracy. Do these reports talk about the reasons why those who have served have different rates of chronic disease and other health issues compared to civilians?
Great question. We often get this question about our America's Health Rankings reports. I think, that the chronic disease data that we have is so very interesting. But America's Health Rankings doesn't answer the question about why these findings are different from civilians, but I do believe it's worth further study, and I know the VA continues to look at these issues. Overall, what America's Health Rankings does in our research, it really underscores the importance of understanding the distinct health challenges faced by those who have served, so we as a nation can better meet their circumstances and healthcare needs. I think the new concentration that FSU is launching in today's conference are vital for preparing healthcare providers, regardless if they're practicing within the DoD, VA, or the community, to care for this population, and just being armed with that information that those who have served, our veteran population, are more at risk for chronic illness.
We also have a two-part question for you, Tracy. Does this research break down data by military branch, and does it allow for the comparison between active duty military service members versus veterans?
And that's a great question. America's Health, the studies that we've done are based on the data from the CDC's Behavioral Risk Factor Surveillance System, BRFIS. There, I said it right. The way the question is asked does not allow us to distinguish military branch or whether someone's been deployed or whether they, either retired or separated from the service. So any of those more details are not, the question is very general. Have you ever served in the U.S. Armed Forces? So the data also doesn't distinguish whether an individual is currently serving on active duty or they have formerly served. So we deliberately don't compare the health of active duty military service members to veterans for that reason.
Thank you.
Are there any other questions out there for Tracy? No? Tracy, thank you so very much. I do have to say that at the end of today, I was going to mention that our next conference is going to focus on women that have served and veterans and all of that. So those statistics that you put up there about the women were spot on. And so that's more to come on that. But I am totally convinced that that's what the next conference is going to address.
That will be time well spent, Sue. Thank you.
Yeah. Thank you very much, Tracy. I appreciate it.
Thank you.
All right. No, we
got a last minute question that
we have another
in.
question.
Oh, late breaking. Okay.
How does data account for minimization of mental health symptoms like suicidal thoughts and alcohol excess, as many active duty are hesitant to admit this?
That's a great question. We see a lot of that in the literature, and I'm sure my colleague who's going to talk next, who actually may have some more thoughts around how veterans are approaching this. What I most appreciate, let me just start with this. I don't think our data can differentiate that. We look at all of those things. We look at frequent mental distress. And that is defined as having had mental distress 14 days out of the last month. I mean, that's pretty significant. And the suicidal thoughts, that's brought in by some of the SAMHSA data. So SAMHSA might have a little bit more detail on that. We didn't talk about some of the behavioral data. I think it was on a slide, but those who have served are more likely to engage in excessive drinking, as well as they have higher rates of smoking and more likely to have insufficient sleep. So there are some dynamics there that play into that. What I'm most encouraged by, and I think the dynamic has really changed over the last few years, is the emphasis that VA has put on mental health care for veterans and how easy they are making it for veterans to get mental health care. There was a big ramp up of telehealth during COVID. That continues, but they're really going to meet the veterans where they are, recognizing that there is this hesitancy and that many veterans aren't comfortable coming forward. But I really commend the VA for what they've done over the last couple of years to really make that more accessible to our veterans.
Thank you. Also, would you be able to repeat the information on grants for military training for mental health professionals? We just needed a clarification on that.
I'm not sure I understand. Oh, was it around the military? Was it around the National Military Family Association and the military spouses?
Yes, I believe so.
Okay. Yeah, we've had a great partnership with the National Military Family Association. They have a very robust scholarship program. And I'd really encourage you, if you have military spouses out there that are looking for support and particularly in the health professions, that's a big focus of NMFA's scholarship program. And what we did with them was we gave them a grant over 3-4 years to really focus on supporting military spouses who want to become mental health professionals, counselors, social workers, psychiatrists, psychologists. And there was a real interest in that. And again, our goal in that was to get more providers into the community to understand the distinct needs of service members, veterans, and their families.
Thank you.
Of course. Thank you.
Any other questions? All right, Tracy, thank you very much. Appreciate it.
Thank you.
Okay.